This video will explain about the unfavorable circumstances of occipito-posterior position. Reference for this video is D.C. Datta's Textbook of Obstetrics, 10th edition. Normally, in occipito-posterior position, occiput rotates 3/8 of the circle. This is the occipital region which is touching the sacroiliac joint and it is rotating 3/8 of the circle. So this was the diameter, oblique, it will come to transverse, once again it will go to oblique and then to the anterior posterior position. When occiput fails to rotate 3/8 of the circle, in the certain circumstances such as deflection of the head, weak uterine contraction, faulty shape of the pelvis such as flat sacrum, prominent ischial spines, convergent side walls, weak pelvic floor muscles and big baby, non-rotation or malrotation occurs. Mainly there are three types: incomplete forward rotation or short anterior rotation. It ends up with the deep transverse arrest. Second one, non-rotation, ends up with oblique posterior arrest. Third one, malrotation, the outcome will end with persistent occipito-posterior position or POP. You can see in the slide, pink color highlighted ones are unfavorable positions in the occipito-posterior mechanism. First one, incomplete forward rotation or short anterior rotation. In this condition, the occiput rotates 1/8 anteriorly and the sagittal suture comes in the bispinous diameter. Thereafter, further anterior rotation is not possible and the arrest occurs. So this position is called deep transverse arrest. So in the skull, this is the occiput region, this is the sinciput and we have the sagittal suture. Occiput occupies the sacroiliac joint as in the occipito-posterior position. Now it is getting rotated only 1/8 anteriorly and we can see arrest occurs, that is nothing but deep transverse arrest. The second one, non-rotation. So here both the sinciput and the occiput touches the pelvic floor simultaneously due to moderate flexion of the head, resulting in no further rotation of the occiput. As the sagittal suture will be lying in the oblique diameter, the condition is called oblique posterior arrest. In non-rotation, if you see in the skull, this is the occiput, sinciput. Occiput as well as sinciput, both will be reaching the pelvic floor simultaneously. So sagittal suture is in the oblique diameter and there is no further rotation occurs. Third one, malrotation. In extreme deflection, the sinciput touches the pelvic floor first, resulting in the anterior rotation of the sinciput to 1/8 of the circle and placing the occiput to the sacral hollow. This position is termed as occipito-posterior position or persistent occipito-posterior position of the vertex. So in the skull, occiput which is touching the sacroiliac joint and the sinciput will be facing the opposite side. It meets the resistance and the sinciput will just rotate 1/8 of the circle and there is persistent occipito-posterior position or the arrest of occipito-sacral region occurs. So in favorable circumstances, that is with an average size baby, good uterine contraction and an adequate pelvis such as anthropoid or spacious gynecoid pelvis, spontaneous delivery may occur. So this is called phase to pubis delivery. In unfavorable circumstances, when arrest occurs, it is called occipito-sacral arrest.